An asthma attack is the term used to describe the worsening of your asthma symptoms. It occurs when your airways go into spasm and the lining of your airways becomes swollen. This narrows your airways and makes it harder for air to get into your lungs. Many people think that an asthma attack is something that occurs suddenly. However, often an attack will come on slowly over a few hours or days. It is important to be able to recognise the symptoms of an asthma attack so that you can quickly do something about it. Signs that you might be having an asthma attack are: your reliever inhaler, which is usually blue, isn't helping. You're becoming more breathless or wheezy. You develop a bad cough or tightness in your chest. You're too breathless to speak, eat or sleep. Your breathing rate and heart rate are getting faster. If you measure your own peak flow, it might be lower than normal. If you or someone you know is having an asthma attack, seek help immediately and follow this emergency advice. If you are having an asthma attack, make sure you sit upright. Don't lie down or bend over, as this can constrict your breathing. It is important to remain as calm as possible during an attack, as this will prevent further tightening of your chest. Take long, deep breaths in through your nose and out through your mouth. Try to move away from any obvious trigger for your symptoms, such as smoke or dust, and move to an environment with clean air. If you have your reliever inhaler, take 1 puff of your medication. If you need further puffs, you can take another puff every 30 to 60 seconds, up to 10 puffs. If you have a spacer device, it is best if you use this. If you are concerned that your asthma symptoms are worsening and you are using your reliever inhaler more often, make sure you arrange an urgent appointment to see your GP or asthma nurse within 24 hours. Even if you aren't suffering an asthma attack, but you notice that your symptoms are gradually getting worse, don't ignore them. Needing to use your blue inhaler more than 3 times in a week might suggest that your asthma is not being as well managed as it could be. You or somebody with you should call 999 if your symptoms are getting rapidly worse, such as a cough, breathlessness, wheeze, tight chest, or due to worsening breathlessness, you're unable to speak, eat or sleep. If you're feeling exhausted, or if your inhaler is not helping your symptoms, never be frightened to call for help in an emergency.